Hello, I'm Aditya Bardia, breast medical oncologist at Massachusetts General Hospital. Today, I'll be reviewing the subgroup results from the phase 3 CAPItello-291 study. As a reminder, CAPItello-291 trial was a randomized phase 3 study that looked at combination of fulvestrant plus capivasertib, which is an AKT inhibitor, versus fulvestrant. This was for patients with metastatic hormone receptor positive breast cancer in the second line and plus setting. Majority of patients in this clinical trial had received prior CDK4/6, which is what we would recommend given the changing landscape. So overall, the study met its primary endpoint. There was improvement in progression-free survival with the doublet of fulvestrant plus capivasertib. The results were particularly significant in patients who had tumors with alteration in the PI3 kinase pathway. So that's PIK3CA mutation, PTEN loss, or AKT mutations. In that subgroup, there was benefit with capivasertib plus fulvestrant that was higher than the wild type group, and there was also trend towards improvement in overall survival. So in November of 2023, the FDA granted approval to fulvestrant plus capivasertib for patients with hormone receptor positive metastatic breast cancer who had tumors with PI3 kinase pathway alterations. We saw biomarker results at San Antonio Breast Cancer Symposium, where the team looked at these different subsets: patients with PIK3CA mutation only, patients with PTEN alterations or loss, as well as those with AKT mutations. And they looked at only these mutations, also patients who had any of these alterations, because sometimes there could be an overlap. But regardless of the type of alterations, whether it's PIK3CA or PTEN loss or AKT, the benefit with capivasertib was maintained very similar hazard ratios, regardless of the type of alteration, which makes sense given that AKT inhibition is downstream of PIK3CA and is downstream of PTEN as well. So it was good to see the data that even in patients with PIK3CA mutation, where you have a choice of fulvestrant plus alpelisib, in this subgroup, the benefit was maintained with fulvestrant plus capivasertib with a hazard ratio of 0.51. So that's doubling of progression-free survival. So these results confirm that fulvestrant plus capivasertib is another therapeutic option in this setting. It's different from alpelisib in the sense that it causes less rash, less hyperglycemia, but tends to cause more diarrhea. So from a patient and provider perspective, it provides another option. And whether to choose capivasertib or alpelisib ultimately requires a patient-centered discussion, talking about the results, including the safety profile with rash, hyperglycemia, as well as diarrhea. There's a third drug which could be considered in this setting for patients who are dual mutants, essentially having ESR1 plus PIK3CA mutation, which is elacestrant, so ultimately requiring a patient-centered discussion as we choose these different therapy options. Thank you for joining today.